Hello everyone. Today we are going to talk about comparison of the various pneumococcal vaccines which is available. This is important for everyone to know, also for the medical practitioners to know when to advise the pneumococcal vaccination and what are its benefits, limitations, and all. So there are two types of pneumococcal vaccines which is available. One is PPSV23 and PCV13. So PPSV, as the name suggests, it is pneumococcal polysaccharide vaccine and it contains 23. It means that it covers the 23 serotypes of pneumonia or pneumococcal bacteria. So there are various serotypes of that. It covers 23 serotypes of pneumococcal. And this is pneumococcal conjugate vaccine. Conjugate vaccine means that the polysaccharide is combined with a protein, usually which is of diphtheria. So diphtheria bound conjugation is there and it covers 13 means that it covers only 13 serotypes of the pneumococcal bacteria. So in coverage, PPSV23 has higher coverage when compared to PCV13. So as we've discussed, PPSV23, that is the polysaccharide vaccine, is T cell independent. It means that it does not stimulate the T cell directly. It only activates the B cell, and this B cells leads to immunoglobulin M formation and produce antibody action via immunoglobulin M. And as we all know that immunoglobulin M is very short lasting. So effect of this PPSV23 is not long lasting. Usually its effects last for 3 to 5 years. And it does not, as we all know, B cell does not create any memory cells. There will be no memory cells. So suppose we are giving PPSV23 to any patient, this has to be repeated once in every 3 to 5 years. Recommendations we will discuss at the end of it. Next is PCV13 conjugate, which is T cell dependent. So as we said, PPSV23 is T cell independent. PCV13 is T cell dependent. So it stimulates the CD4 cells or CD8 cells, and it also leads to formation of memory cells. So it has a longer duration of action. So suppose we give PCV13, it effectivity stays for longer duration and repeated doses are not required for PCV13. So as we said, serotype coverage wise, PPSV23 gives 23 serotypes, whereas PCV13 has 13 serotypes. Immunological response wise, as we discussed, PPSV23, that is pneumococcal, that is polysaccharide vaccine, it does not stimulate the T cells. There is no memory B cells formed. PCV13 has both T cell stimulation and memory B cells is also formed. Important thing to remember is that when you do a revaccination, suppose if you give any patient another PPSV, the activity will be, the response is less. So there is no stimulation of that or hyperresponsiveness because see, suppose you have given a PPSV and just acts on the B cell and T cell, it is not T cell dependent. So there is no memory cell that's formed. And your body is now already used to that bacteria. Now body also says that, yes, I know this bacteria already. So there will be no hyper responsive to that. So that means there will be reduced performance of these vaccines on repeated doses. So that's why repeated doses also is not much recommended with this vaccine unless and until absolutely indicated. Whereas PPSP, that is PCV13, that is a conjugate vaccine, has a boosted response because it activates the T cell and has a memory cells also. And there is, whenever there is memory to that, so body tries to attack it with with more immunity and all, and there will be more boosted response to that. So we stay in illusion that when you give pneumococcal vaccine, we will not get pneumonia. So it is not like that. The basic role of giving pneumococcal vaccination is not to prevent pneumonia, but basically to prevent the danger side of it, that is converting pneumonia into sepsis or invasive pulmonary disease. That is invasive pneumococcal disease. That means that if you take pneumococcal vaccination, you can get still get pneumonia, but this pneumonia will not get very severe to cause invasive pneumococcal disease, and the chances of getting sepsis and getting worsen is less when you take pneumococcal vaccine. However, this vaccination does not prevent much against the general pneumonia as such. So PPSV23 has no prevention against pneumococcal. So against pneumonia, it does not prevent at all. There is limited or inconsistent protection. However, PCV13 has a reduction, some effect in reducing pneumonia as well, but the efficacy is only 45.6%. That means below 50% it can prevent. PPSV23 does not prevent against pneumonia. However, both of them prevent against the invasive pneumococcal disease, which is the life dangerous. So PCV13 has up to 75% efficacy, whereas PPSV23 is up to 50 to 80% depending upon various studies. So important thing to remember is that in fact in immunocompromised patients, so patients who are immunocompromised, their B cell activity will be very less. Their immunity is not there much. So B cell formation of immunoglobulin M all will be very much reduced. And thus, if you take this vaccine, there is polysaccharide vaccine here, there will be no much response as such. So in immunocompromised patient, PPSV23 is not indicated. PCV13 has a more effective in this group of population. So co-administration with other vaccinations, PPSV23, that is polysaccharide vaccine, you can give with other vaccines as well. There is no issues with that, but you should not give along with PCV13 because PPSV23 decreases the efficacy of PCV13. Because if you give PPSV23 first, there is no memory cells and nothing are formed. So your body is already now have got used to this polysaccharide vaccine already. So now what body says is that I have already known this pneumococcal vaccine. I know these vaccines and all the serotypes. I already am aware of that. So it does not attack it on so much. So see, suppose your first time if a body get exposed to an antigen, the chances of body responding to that is very high. However, with repeated exposure, the chances keeps reducing because the body is already used to those foreign body. So if you give PPSV23 first, the efficacy of PCV13 automatically decreases. So that's why PCV13 should always be given prior to PPSV23 because it has a higher long-lasting effect. So coming to recommendations wise, so suppose patient is between 19 to 64 years, that is adult age group. So patient is healthy adult, that means there is no comorbidities, no routine pneumococcal vaccination is required. So 19 to 64 years, if there is no medical comorbidities like diabetes, hypertension, pneumococcal vaccination is not required. Suppose patient have a chronic illness like diabetes, any heart disease, liver disease, lung disease, or patient is a smoker or alcoholics. In that patients, you can give first you should give PCV13, wait for 8 weeks, and then you give PPSV23. So why do we need to give PPSV23 despite it is less efficacious than PCV13? Only thing is that it covers a wide variety of serotypes. That means 23 serotypes it covers, whereas PCV13 covers only 13 serotypes. So only for that reason we have to give PPSV also after PCV13, and that we should keep a gap of at least 8 weeks to prevent the sensitivity. Suppose patient is having high risk conditions like there is no spleen. So patient with splenectomy, they are more prone to infections of gram negative, sorry, so gram positive bacteria. So they're more prone to that. So that's why in those patients, it's definitely pneumococcal vaccination is indicated. So similarly, same PCV13 first, followed by PPSV23. In immunocompromised patients like HIV, patient of chronic kidney disease, malignancies, or transplant patient, you give PCV13 first, followed by PPSV23 after 8 weeks. So next go to second condition where patient is adult is a more than age of 65 years. Patient is supposed more than 65 years. So this all we have talked about in when patient is 19 to 64 years. So more than 5 years already patient is tends to have more chances of infection because naturally immunity comes to decline with age. So you have to give single dose of PPSV23 it should be given to all patients. Suppose there is no medical comorbidities other than the age, you have to give only single dose of PPSV23 is sufficient, because as the age grows, we expect the life expectancy to be less. So we do not want a very long duration one and want a more efficacious one. So that's why PPSV23 is single dose is sufficient. Suppose patient having high risk behavior, like patient having comorbidities and all, then definitely we have to give PCV13 first, like full vaccination. PCV13 first, followed by PPSV23 more than 8 weeks. So with chronic condition, you should decide a non-immunocompromised decision to give PCV13 first should be made jointly by the doctor and patient. So revaccination, routinely it is not required, can be considered once after 5 to 7 years, and that too only PPSV23 has to be given then. Suppose if the first dose was given before the age of 65 years, then you have to give another dose after the age of 65 years if more than 5 years has happened. Why happens? Because revaccination usually decreases, leads to hyporesponsiveness. So points to remember, do not administer PCV13 and PPSV23 together. Administer PPSV23 first. It reduces that. You should not do that. Because if you give PPSV23 first, it reduces the efficacy of PCV13. Suppose patients are going for a Hajj or pilgrimages, if they are going, or for many mass gathering, they should receive PCV vaccination 4 weeks prior before travel. And PPSV13 23 you can give after returning based on their indications. Some considering cost, PPSV is lower cost, PCV13 is somewhat higher cost, but it is more effective.